I'm Alpha Phi Alpha Surgeon General, Dr. Jeffrey Sterling. This vlog is on what you need to know about blood clots and travel. Anyone traveling for more than 4 hours, whether by air, car, or by bus, can be at risk for blood clots. We're going to show you how to protect yourself this travel season by moving around, knowing the symptoms, and knowing when to speak to your physician. More than 300 million people travel on long distance flights, which are generally more than 4 hours each year. Blood clots, also called deep vein thrombosis, can be a serious risk for some long distance travelers. Most information about blood clots and long distance travel comes from information that's been gathered about air travel. However, anyone traveling more than 4 hours, whether by air, car, bus, or train, can be at risk. Blood clots can form in the deep veins, which are below the surface, not visible through your skin, within your legs during travel because you're sitting in a confined space for long periods of time. The longer you are immobile, the greater is your risk of developing a blood clot. Many times the clot will dissolve on its own. However, a serious health problem can occur when a part of the blood clot breaks off and travels to the lungs, causing a blockade. This is called a pulmonary embolus, and it may be fatal. The good news is there are things that you can do to protect your health and reduce your risk of blood clots during a long distance trip. Even if you travel a long distance, the risk of developing a blood clot is generally very small. Your risk depends on the duration of travel as well as whether you have any other risk for blood clots. Most people who develop travel-associated blood clots have one or more other risks for clots, such as those shown on this slide. They include an age over 40, obesity, recent surgery or injury within 3 months, contraceptives such as birth control pills, hormone replacement therapy, if you're 3 months postpartum or if you're pregnant, you have a family history of blood clots, or if you've had a blood clot, if you're a recent cancer survivor or have had recent cancer treatment, if you have varicose veins, a large catheter placed in a large vein, or if you have limited mobility, these all represent risk. The combination of long distance travel with one or more of these risks may increase the likelihood of your developing a blood clot. The more risk you have, the greater your chances are of experiencing a blood clot. If you plan on traveling soon, talk with your doctor to learn more about what you can do to protect your health. The most important thing you can do is to learn and recognize the symptoms of blood clots. Let's talk about deep vein thrombosis, also known as DVT. About half of the people who get DVTs have no symptoms at all. However, in those that do, the following are the most common symptoms of DVTs in the affected part of the body, which is usually the leg or the arm. There could be swelling in that area, the leg or the arm. There may be pain or tenderness that you can't explain. The skin may be warm to the touch and the skin may be red. If you have any of these symptoms, contact your doctor as soon as possible. When we talk about pulmonary embolism, also known as PEs, you may have difficulty breathing. You may have a faster than normal or an irregular heartbeat. You can have chest pain or discomfort, which worsens with coughing or deep breathing. You may have anxiety. There may be coughing up of blood. You may faint or otherwise feel lightheaded. However, as was the case with DVTs, you can have a pulmonary embolism without any symptoms of a DVT. Here are some tips on what you should know and look for. You need to be alert to the signs and symptoms of blood clots. Please talk with your doctor if you think you may be at risk for blood clots. If you have had a previous blood clot, or if a family member has a history of blood clots or an inherited clotting disorder, you must learn about your individual risk. If you're at risk, talk with your physician to learn more about how to prevent blood clots. For example, some people may benefit by wearing graduated compression stockings. If you're on blood thinners, also known as anticoagulants, be sure to follow your doctor's recommendations on medication use. Here's some things you can do. Move your legs frequently when you're on long trips and exercise your calf muscles to improve the flow of blood. If you've been sitting for a long time, take a break and stretch your legs. Extend your legs straight out and flex your ankles, pulling your toes towards you. Moving them in a circular motion also helps. The airlines are keen on suggesting that if you pull your knee up towards your chest and hold it there with your hands on your lower leg for 15 seconds, this also helps. You can repeat this up to 10 times. This improves blood flow as well as provides you with a good stretching exercise. All of these types of activities help improve the flow of blood in your leg and reduce the risk of a DVT or APE. Look for additional content on Sphinx TV on many topics of health and to help assist you in your health journey. I am Alpha Phi Alpha Fraternity Surgeon General, Dr. Jeffrey Sterling. Thank you for watching.